Okay, we might start now. So if you're just joining us, welcome to our third Breathe Better class, so breathing better with exercise. We're really happy that you're able to join us this evening. In tonight's class, we'll be talking about exercise and asthma and some breathing techniques that can help anyone with their recovery from exercise. We'll also be highlighting what role exercise plays in keeping healthy and how to get started on including some of those exercises into your routine. As with any health information, please consult your doctor about whether this information is right for you. My name is Janine Lorenz, and I'm one of the Asthma Australia staff. I also have Diane Percy with me, who will be monitoring the questions for us online, and also our go-to guru, Dan, helping in the back end with our tech. Also joining us tonight is our guest presenter, Janet Bondarenko. A little bit of background about Asthma Australia. For those who don't know, Asthma Australia is the peak body for people with asthma, and as our name suggests, we are nationwide. Our website highlights the most asked for asthma information, and we provide a free phone service on our 1800 asthma or 1800 278 462 number, where you can speak to an asthma educator for more personalised information about yourself or someone you care for and your asthma. So this is our third webinar in a series of 3 Breathe Better classes that we've run in the past year. The session will be recorded and you will receive an email with a link in the next day or so. We intend for the session to run for about 45 minutes and then have time for questions at the end. So some of the questions we might be able to answer via the question functions, or I might redirect you for a chat with one of our asthma educators through our book a call function, but we'll try to get through as many as we can with Janet at the end. As mentioned earlier, for people watching live tonight, if you think of questions during the session, you can submit them in the questions box. If the time permits at the end of the presentation, we will address as many of those questions we can submitted through that feature. And as I mentioned earlier, if you have any problems with the sound or the slides, please let us know in that questions area. Most importantly, we do have a survey for you to complete at the end, which is really important to us as it helps us to plan our future webinars, and we really do read all your responses. So I'm going to pop a link in the chat now. So if you do need to leave early, please still fill it out before you go. We'd really appreciate it. We'd love to know what else we can help you with. So I'll just pop that in there now. Yeah, I might get Diane to do that for me. That's all right. So before we start, I'd like to begin this meeting by acknowledging the traditional owners of the lands from which we're all meeting virtually together this evening. Personally, I would like to acknowledge the Ngunnawal and the Ngambri people who are the traditional custodians of the land from which I am presenting, and pay my respects to their elders, past, present and emerging. Also, I would like to extend a warm welcome to any Aboriginal and or Torres Strait Islander people who are joining us tonight. So Janet, where are you joining from?
Yeah, I'm on. Thanks, Janine.
You're on.
Thank you. I would like to pay respect to the Boonwurrung and the Wurundjeri clans of the Kulin Nation, which is where I'm presenting from tonight.
Fantastic. So I'll just give you a quick introduction, Janet. Janet's going to take us through this Breathe Better class tonight. Janet Bondarenko is a senior respiratory physiotherapist at the Alfred Hospital in Melbourne. Physios specialising in lung care are a bit hard to come by, so we're really lucky to have Janet with us today. She has extensive clinical experience in the management of chronic respiratory disease and currently coordinates the Pulmonary Rehabilitation Program and the Outpatient Physiotherapy Respiratory Clinic at Alfred Health based in Melbourne. And on top of that, she is a PhD candidate researching the characteristics and treatment of dysfunctional breathing and asthma. So the topic tonight around exercise and breathing isn't always a one-size-fits-all. So it can be an area where you might need to really get further help through your doctor, or to find out whether you do need specialist input from someone like a respiratory physio. So we're really excited to have Janet speaking on this topic, but ask your doctor to refer you to someone local to get a plan that suits your needs. So Janet, that's enough from me. I'm going to hand over to you.
Thank you. Oh, there I am. All right, and thank you to Asthma Australia for asking me to present tonight about exercise. So what we'll be talking through tonight is who should be exercising, and that's probably the easiest. What the benefits are of doing exercise, especially when you've got asthma. What type of exercise is what is recommended. How hard you should be exercising, when you should stop exercising, and then some tips on how to get started, stay motivated, because these are sort of things that all of us really deal with our exercise programs. So I'll start with who should be exercising, and again, this should be easy. So exercise really benefits everyone, regardless of your age, your physical ability, or the severity of any sort of lung disease you might have. Everyone benefits from doing exercise. Just going to, no. Can we advance the next slide, Janine?
Yep.
Thanks. Sorry, I don't know if I've got control at the moment, but that's all right.
You should have.
Okay.
Give it a go again.
I'll do this one, yeah. So why is exercise so important? And exercise really benefits your mind and your body. So we know the sort of physical benefits that we get from exercise, and that you can breathe easier. It helps you maintain your cardiovascular health, so keeping your lungs and your heart healthy, prevents illness and the risk of chronic health issues. You can have more endurance and balance and flexibility, keeping your muscles, joints, your bones strong. It can help you manage your weight, sleep better, and then also things for your mind. So relieve your stress and increase your sense of well-being, and also increase your energy levels. And if you're also exercising in sort of the right way, you can also improve your immune function. And what we often see, though, in people with any sort of lung problem is that if you start to feel breathless, you often stop doing things that make you feel breathless. And then when you're avoiding those sorts of activities, your muscles get weaker and they get less efficient at using oxygen, and consequently you then feel even more breathless. And so what we don't want is people going into that sort of downward spiral of stopping doing things and then getting more breathless. So exercise can really help break that cycle, but also improve your well-being. Oh, I went too far. And there's been some really good evidence around how exercise can benefit people with asthma. So on the right here was what's called a systematic review. So this was published in 2020, so quite recently. And it actually included the results on 11 studies looking at exercise in people with asthma. So that included over 500 people with asthma. And they found that the people who were doing exercise training, some sort of exercise training 2 days a week for 8 weeks, increased their lung function, and they also increased their asthma control. And then on the left here is a study that was actually hot off the press, so recently just published a couple months ago. And it showed that for people with asthma, if they did one bout of exercise, of moderate intensity exercise, so one exercise session, they had decreased airway inflammation in their lungs. And so it's really that the key is this moderate intensity exercise. So we can see that no exercise doesn't benefit you, but consequently this really vigorous exercise where you're working really, really hard doesn't necessarily give you the benefits as well. And we'll talk about what moderate intensity exercise is a little bit further down. There we go. So what type of exercise should we be doing? And for the guidelines for physical activity, and this is for all of us, is that all of us should be trying to achieve 150 minutes of moderate intensity aerobic exercise every week, and that we should be trying to do some muscle strengthening exercises at least twice a week. but really you want to try and become physically active every day. So any activity is better than none, and trying to spend less time sort of sitting down and lying down and more time being upright and doing things. So most people can safely perform some light to moderate cardiovascular activity, so things like walking, cycling, dancing, and also some light strength training. I don't know why this isn't working.
Do you need me to advance it?
I think so. It doesn't seem to be working very well for me. Sorry. Thank you. Okay, so the first thing is really how to sit less. And I think it's important to think of movement as an opportunity. So not, not a consequence, but movement is an opportunity for all of us. And any small amounts of movement that you perform throughout the day can benefit your health. So, and also some people find it easier to be active in lots of different ways rather than just doing one long session. So for example, if you're at home when you're watching TV, if there's a commercial ad break, get up, walk around your house, do an active chore. So that could be, putting the laundry away, making your bed, something like that. Trying to use the stairs when you can rather than taking the lift. Sitting up and standing down. I tell this to a lot of patients every time you get up. So if you think you're getting up to the kitchen to make a cup of tea, try and get up from the chair, go up and down 3 or 5 times, because that gives you some nice little incidental exercise throughout the day. Do some arm and leg exercises in the kitchen if you're waiting for the kettle to boil, walking around your house every 1 to 2 minutes. And if you can't walk or stand, there's lots of different seated exercises that you could do. And so things that you can do in your chair every hour or something like that. So really just trying to think and incorporate movement and think of movement like an opportunity in your day. Next slide, thanks.
Try it again, Janet.
Yeah, it's not even coming up down the bottom for me, but anyway.
Try it
So strength exercises. So these are the sort of exercises that increase your muscle strength by making your muscles work against some sort of weight. So there's different forms of strength training, and you can use weights, you can use machines at the gym, resistant bands, or your own body weight. And some examples of sort of simple strength exercises are things like standing up from a sitting position, doing some squats, step-ups, lunges, heel raises, marching. You could do, you can do wall push-ups. You can also do push-ups on the ground if you're at that sort of level. Shoulder press, bicep curls, punches, using different resistant band or sort of seated rows. So staying strong is really important because it maintains your flexibility and your balance. It protects your joints from injury. It strengthens your bones, and it can also improve your posture. I got it. Thank you. So just some general tips when you're doing strength exercises is that it's important to build up really slowly, especially if you've not done any sort of strengthening exercises before. So starting out with being able to do, say, 2 sets of 5 reps. So if you were doing an exercise above your head, you could do 1 5 times, have a little rest, and then do it again 5 times. And once you feel like you could do a strength exercise quite easily, you can do 3 lots of 10 or 12 reps easily, then you can add some extra weight or increase it. And as a general starting guide, it's probably good to pick just 2 arm exercises and 2 leg exercises per session, and then you can build on that. And you can do sorts of, you can do a lot of strengthening exercises at the gym, but you can also do a lot of exercises at home. So you can there's a lot of equipment, common household items that you could use. You don't really need to purchase anything extra. You could use just making sure that you're near a counter or a chair if you need to hold on to something. But you can certainly do push-ups on your kitchen bench. We've got these sort of dishwasher squats where you just unload 1 item at a time and do a squat each time. Empty milk jugs and water bottles are excellent to use as light weights, but you could also fill a shopping bag with some books or tinned food. You could put some of that tinned food or books into a backpack and then climb the stairs with a little bit of an extra weight around you as well. So there's certainly lots of things that you can do at home. Like I said, get creative in the kitchen and thinking about that sort of as your little, potentially your home gym. And then we get to moderate activity. And moderate activity is sort of a type of cardiovascular aerobic exercise. So things that make your breathing, that increase your breathing and your heart rate. And that includes activities like walking, cycling, running, swimming, dancing, some heavy gardening, those types of things. And this type of exercise is really important to keep your heart and your lungs and your circulatory system healthy. And it's recommended that you do up to 150 minutes a week, or not up to, sorry, at least 150 minutes a week of moderate activity. But it can be broken up into smaller sessions. So every little bit helps. So you could do 3 lots of 10 minutes a day, or you could even start with just 5 minutes a day and gradually build up, especially if you're not regularly active or you're a little bit frightened about starting some exercise. It's safer to be active for shorter periods more frequently than try and be active for those longer periods when you're not used to it. But again, every little bit helps. So things like, again, taking the stairs instead of the lift, walking instead of driving for shorter distances, all of those things add up into your 150 minutes per week. All right, but to get the benefit from moderate activity, it's really important to exercise at the right intensity. And one way to measure how hard you're exercising is by using some of these scales. So these scales measure how hard you feel your body's working during exercise, and also how breathless you feel. So using this rating can be quite easy, but it also correlates to what your heart rate is doing during physical activity. So for exercise to be beneficial, and we want to get that sort of moderate intensity, you should feel like your body is working somewhat hard or hard. So anywhere on that right scale between 12 and 15. And that you're feeling moderately breathless. So if you're doing some exercise and thinking, how breathless do I feel at the moment? You should feel slight breathlessness, moderate breathlessness, a little bit of somewhat severe, that's okay as well. But pushing yourself so you're completely out of breath or you're feeling severe breathlessness, maximal, is not going to give you any extra benefits. And so most of the evidence shows us that it's working or in this sort of moderate intensity that gives people benefits, especially people with asthma. So it's good to practice monitoring yourself and practice monitoring how your body feels during exercise. And so when you know to adjust your intensity of your exercise. Oops, where to start? I think I've gone too far ahead. There we go. So it's really important to start at your own pace and your own level. So little and often might be a lot better for some people, especially if you're not used to exercising. And again, practice monitoring your intensity on those exertion scales. So do you feel like your body is working somewhat hard? Are you moderately breathless? And then you know that you're working at that right sort of pace and level. But if it's too much, then you need to drop it back. It's good to try and maybe set up a regular routine to be active every day. So put time in a diary or to remind yourself, or set yourself some reminders on your phone. Setting goals for yourself is really, really important. You could write them down, put them in an app, you know, and it gives you that motivation to keep going. And also start to think about what might get in the way. So you might start the week out saying, I'm going to do some exercise on Tuesday or Wednesday or whatever day it might be, and start to think about things, well, what might get in the way of that plan and what can I do about it? So that if it suddenly rains on that day, you've got a backup plan and you keep to your set schedule. Really good to record your progress. So that could be, you know, the time that you're spending doing exercise, step counts, those sorts of things. Often we can use our friends and our family. They're really great motivators, and we can plan to do some activities together. And if you're really unsure of where to start, you could consider joining a pulmonary rehab program. So these are programs that are usually run, they're run nationwide, usually at community centres or hospitals. And they're around 6 to 8 weeks long, and they teach you how to exercise safely and manage your lung condition. So you would have a comprehensive assessment prior to starting one of those programs, and the clinicians would develop an individualized program for you. And generally you'd come in and do some supervised exercise twice a week. And some programs also offer home-based programs or programs over telehealth as well for those who can't travel. So that's a really good option as well if you're really just not sure where to start. And of course, it's really important to exercise safely. So one thing is always to take your inhalers if they've been prescribed by your doctor. So take them before you're doing some exercise, and have them with you when you're doing exercise. So make sure that you take all your medicine with you, or your inhaled medicine, making sure that you're drinking enough fluids. Always do a warm up and a cool down, and always restart your exercise program at a lower intensity if you've not exercised for a while or you've been unwell. And some other things are just general tips around wearing comfortable, loose clothing, comfortable, appropriate shoes, and always waiting about an hour after you've eaten before you do any exercise. Okay. So exercise can be a trigger though for people with asthma. And so exercise-induced bronchoconstriction, which was previously known as exercise-induced asthma, is really this temporary narrowing of the lower airways, and it happens as a response to vigorous exercise for some people with asthma. So it means that the lungs become, the airways, become swollen, inflamed, and blocked with mucus, which can narrow the airways and make it more difficult to breathe. And often with heavy exercise as well, breathing increases, which leads to drying of the airways, and then the upper airways are unable to keep up with the demand of warming and humidifying the air, and that increases drying and cooling, which again increases inflammation and makes the airway, causes the airways to narrow. So people with asthma and also people without asthma can also get some of these symptoms. And there can also be a lot of other conditions that can cause similar symptoms. So it's really important to see your doctor and to get a proper diagnosis and a plan, because most people with exercise-induced bronchoconstriction can remain active by using their asthma medications and then taking preventative measures. And there's also a lot of environmental irritants that can cause bronchoconstriction in people with asthma who are exercising. So things like cold, dry air that causes a lot of constriction in the airways, air pollution. So if it's a really smoggy day, that can cause a lot of chest tightness and bronchoconstriction. High pollen counts, which we've certainly had experiences with. I'm down in Victoria. A lot of airborne irritants. So when there's bushfire season, there's a lot of smoke in the air, or smoke from wood burning fires. Often chlorine in swimming pools can be a trigger for some people as well. And also if you've had a recent cold or a recent asthma attack. So all those things can trigger bronchoconstriction as well. So if you think that some of those things are triggers for you, really trying to avoid exercising in the cold parts of the day. So, you know, avoiding the early morning or late evening, watching the pollen count in the air and making sure that you're not going out to exercise on days that have high pollen counts. And same thing is just being aware of those airborne irritants as well. But again, if you have any of those symptoms, it's really important to see your doctor and get a plan to manage those, because most of them can be quite safely managed with the medications. And then breathlessness. So this is another aspect which obviously stops a lot of people from taking on doing some exercise, because breathlessness is a really complex sensation. It's different for everyone, but it's not a nice sensation as well. So it's very similar to pain actually, in that we all feel it very, very differently. And so how you would manage your breathlessness will be different from one person to the next as well. But again, the most important thing is really not to push yourself to the point where you're really, really out of breath. So we're looking at our practicing rating ourselves on how we're feeling when we're exercising. And again, you shouldn't be pushing yourself into those levels where you feel severe breathlessness, very severe, or maximal breathlessness. It doesn't benefit you, but also it's a horrible sensation. So we want to be exercising where we're feeling slight, moderate breathlessness. But also it's important, like I said before, to take your inhalers as they've been prescribed. There's some breathing techniques that can help you recover from breathlessness with asthma, which we'll go through on the next slide. There's certain recovery positions that you can use as well to recover from breathlessness and exercise a little bit quicker. But again, pace yourself and keep your breathlessness manageable. If you feel like your breathlessness isn't going away or it's worse than normal, then again, making sure that you're seeing your doctor so that any of those underlying conditions can be treated. Okay, so the first thing we'll talk about is some breathing exercises to manage breathlessness after you've done some exercise. So the first one is pursed lip breathing, and a lot of us probably do this instinctively anyway. But what it does is it helps to keep your airways open for longer periods of time, and that way you can get more of the air out of your lungs. So it's really important with recovery is about actually getting air out of your lungs. And so what you want to do is tighten your lips like you're blowing out a candle, and you're exhaling slowly and completely through your pursed lips. So you're breathing in, and like you're blowing out a candle. And again, we just want to make sure that the breath out is longer than the breath in, because again, breathlessness is often around that we can't get air out of our lungs. And you might do this instinctively anyway when you've done some exercising and needing to recover. A really nice, another simple way to manage that sort of breathlessness is using a fan. So any sort of airflow that we can get around your nose and the lower half of your face, it just sends a message to your brain, which sort of reassures your brain saying, I'm getting enough air, it's okay, and it reduces that sensation of breathlessness. So if you've got some sort of handheld fan, you can hold it around 15 centimeters away from your face and moving it around side to side, and so that you're getting some airflow through that sort of lower half of your face and stimulating all those nerve endings, you know, in your nose and around your mouth. If you haven't got a handheld fan, that's fine. It's really just about airflow. So you could use a cool flannel, you could use a paper fan or a bit of paper that if you've got some around, a desktop fan, any of those things just to get that air flowing around your face. And then positioning. So again, this is something that we probably do instinctively, but when you lean forward and you support your arms and your shoulders, it puts your breathing muscles in the most efficient position and helps you relax and recover. So any time where you can lean forward, you can rest, you can pop your hands on your hips, on your legs, leaning forward. If you're sitting down, you could lean on a table in front of you, leaning on a wall, a bench, also using a walking aid. It doesn't have to be a walking aid. Some patients tell me they use the shopping trolley whenever they go to the shops, and they can lean on that and walk around and do some exercise, and just being in that forward lean position just helps you recover a little bit better from your exercise. Apologies for the, I'm currently at the hospital right now, so you can hear some of those announcements. And how to keep motivated. And this is tricky, because for all of us, I mean, the wheels fall off our exercise programs all the time, but it's important to set yourself small, achievable goals. So starting off slow, and it could be that I'm going to walk up and down my hallway for 5 minutes once a week or twice a week or something, and then building on that. Try and find something that you enjoy. So not everyone likes walking. But if you could put on your favorite music, dance around your lounge room, as long as you're, thinking that you're working somewhat hard when you're doing your dancing, then you're hitting that right intensity. That's a really nice exercise to try. Planning ahead, again, making a plan in your diary, thinking ahead around what sort of things might get in the way of you achieving that goal, and then having a backup plan as well. And there's certainly lots of online or in-person exercise classes. There are also lots of sort of, you know, pre-recorded exercise classes that you can do online. Try exercising with friends. You could use a step count on your phone or your pedometer as a sort of motivation to keep going, using some sort of exercise diary or planner. Or again, if you're really if you're struggling getting started, you know, consider joining a pulmonary rehab program. But you know, the benefits of exercise for people with asthma is quite strong, and it's difficult to start. It's difficult to start even when you don't have asthma. But if you're having trouble, then again, reach out to one of the educators at Asthma Australia, or consider joining a pulmonary rehab program. And yeah, I guess getting started is the hardest part. So just got some extra resources here as well. So from Asthma Australia, if you wanting to, or potentially finding a respiratory physio or finding a pulmonary rehab program, those resources are there. And I'm happy to take any questions.
Thanks, Janet. That was fantastic. One of the questions that a consumer had popped through to me was, why is it necessary to do a warm up and a cool down with exercise if you do have asthma?
Yeah, it just gets your body ready to do the activity. So often jumping straight into doing moderate, and it's more important for these moderate intensity activities. It prepares your body, it gets the blood flowing through the muscles to start with, and so it prevents you from getting injuries, and also and you recover quicker as well. And it doesn't have to be a big, you know, big warm up or cool down. It could be a few simple stretches, but just gradually building up to that moderate intensity. So it could be, again, a minute or two of something really light intensity, some stretching, some yoga, and then getting into the moderate intensity. So you're less likely to injure yourself if you do a warm up and a cool down, but it also prepares your body for that activity.
Lovely. And there was another question in regards to wearing a mask and exercising. Are you able to talk around that a bit?
Yeah, and that's been an issue, obviously, for the last couple of years. So wearing a mask, it can increase your work of breathing, which means that it can be harder to breathe in and out when you've got a mask on, but it doesn't affect your oxygen levels. It certainly doesn't affect, you know, how much carbon dioxide you're breathing out, any of those things. It's just you have to work a little bit harder sometimes to get the air in and out. And so really it would just be then adjusting your intensity based on, again, how you're feeling. So practice rating yourself. You might find when you've got your mask on that you can't walk as quickly, but as long as you're hitting those targets and feeling that you're working moderately hard, then that you're still going to get the same benefit from it. Consequently, mask wearing can be quite useful for people with asthma because it can filter, you know, humidify the air a little bit, especially in really cold weather. So wearing a mask, or we're coming out of winter now, but we'd often suggest to people to put a scarf on as well over your nose and your mouth, because that will humidify and warm the air before you breathe it in. But again, with air pollution, if there's smoke, any of those things, wearing a mask can actually protect you from some of those environmental irritants, which might be a trigger for bronchoconstriction as well. So there is, you know, it might impact your work of breathing a little bit, but it doesn't affect your oxygen levels or anything like that, and it might protect you from some of those environmental triggers.
Yeah, even pollen.
And pollen, yes, which we're coming into now. Yeah.
Yeah, definitely, definitely. And I think there was another question here, which was, can you still exercise after an exercise asthma exacerbation?
Yeah, I think you can, but you need to listen to your body and start back at a lower intensity. So you won't be going back to what you were doing immediately before your asthma exacerbation. So starting back at a lower intensity and then building yourself back up again. But also, if you're concerned about that, then also see your doctor or talk to a professional about that. But it's important just to start back at a lower intensity. So you might not want to go back thinking that your body's working hard. You might want to just start back with some very light intensity exercise and then build it up again.
Yeah, I guess I'm sort of thinking of someone that may be out on a field playing their sport and they have a bit of an asthma exacerbation. Maybe they use
Then in
some of
there.
their,
Yep.
yeah, their reliever. And then if they go back out, you know, should they be going back out? And yeah, how would you sort of consider answering that?
I think it really depends on the person as well and how they're feeling.
Yeah,
So I
definitely.
think that if they've obviously taken their medication, but they're still breathless, they might still feel tight and wheezy, then I would say no. um, but if you feel like, yeah, I'm back, I can take a deep breath, I haven't got that wheeziness, the medicine's done what it's supposed to do, then yes. But monitor yourself and know your symptoms.
Mm, fabulous. And just in regards to using reliever medications or preventer medications with asthma, any sort of advice around how they're used?
So it's important to use, especially, well, if you've been prescribed your medication, take it around 15 minutes before you're going to do some exercise, and always bring it with you, and always discuss your action plan with your doctor as well. So if you are someone who gets, exercise-induced bronchoconstriction, making sure that you've got a plan to manage that when you're exercising, and so that you're then taking your prescribed medication as prescribed as you need to according to your action plan.
Fabulous. And Diane, are there any other questions that you've come across?
Yes, I did send some through to you, Janine, but I'm happy to go through a couple. Can you hear me okay? Yeah?
Yes.
Yes.
There is a question, what about seniors? At age 72, I'm relatively fit for my age. Is it safe to do 150 minutes 2 times a week of moderate intense aerobics?
Yes.
So I'm not too sure whether it's intense or intensity.
So moderate, I think it's aerobics. I think we sometimes get scared off by the name aerobics, but again, it's using those scales to rate how you're feeling when you're exercising. So it could just be a brisk walk, going for a brisk walk. If that makes you feel like you're working moderately or somewhat hard, then that's the right intensity for you. So absolutely that most people should be aiming for that sort of target, around 30 minutes, 5 days a week.
Great, thank you. There was another question. My asthma is not well controlled, despite great effort by my specialist. So I get breathless quickly with mild to moderate exercise, walking on mostly flat terrain. How far can you push the breathlessness or exercise when having an asthma episode?
Not at all. So don't try and push through it, I think would be my advice. And I think that in that sort of instance, it's probably good to have an assessment and perhaps see someone around strategies to what sort of intensity you should be exercising at, but also strategies to help, sort of individual strategies. There might be some more specific breathing exercises we could try, but also reducing that intensity. But yeah, don't push through if you're getting an asthma attack. Don't try and push through it, not at all.
There was another question around using a mask. Is it safe to breathe in one's own carbon dioxide?
With the masks, yes. So the evidence has shown that it doesn't actually increase your carbon dioxide. It doesn't decrease your oxygen. So yes.
Lovely. And I think the other one was, is there any way to differentiate between breathlessness and the start of an asthma attack? Sometimes the fear of an attack prevents harder intensity exercise.
Yeah, and that's really tricky. I think that if you are breathless and it's not, you take your reliever medication and it doesn't help, then it might not be bronchoconstriction. But again, I think in those instances, it's really important to talk to someone, an asthma educator, or have an assessment with someone so that you can learn the difference between what is having an asthma attack and what is me just being breathless because I'm doing exercise. And so you might feel a lot more supported in a supportive environment where we could manage that with you.
Mhm. Great. I think that's all I've got from my side.
Excellent. You're muted, Janine.
Oh, I've got
Someone had to say
another
it. Does leaning forward help in an attack while exercising?
Yes, yes. So if you're having an asthma attack, first thing obviously would be to follow your action plan and take your medications, but then using those strategies as well. So leaning forward, supporting your shoulders and your arms, using that pursed lip breathing, using some airflow around the face, all those things can help you recover. But most importantly, follow your action plan.
Mm-hmm. I do have
And
another question.
I'll go for it.
Yeah. I need to be reminded which direction to move my diaphragm, and I'm sure others would need to know too.
Yes. So your diaphragm is this very large muscle, like an umbrella, that sits underneath your rib cage. And what we want it to do when you're breathing is to flatten down. So when you breathe in, you would see this expansion of your stomach. So almost like you're blowing up a balloon into your stomach. So that's your diaphragm going down. So breathing in, your stomach expands. And then when you breathe out, your stomach comes back.
Great, thank you.
That answer that one? Yes.
I've got a question here. Do you need a GP referral to do a pulmonary rehab program?
It depends on the program. So you can look up on the Lung Foundation website. They do have a map where you can look up where the local centres are for you. Some centres accept self-referrals, and other centres will require a GP referral. So it really just depends on which centre is local to you.
Any more questions from you there, Diane?
I'm just going through them now. I don't think so. There's a few comments, but I think we've answered most of the questions.
Some of the questions might need a bit more of a personal response, so we won't be asking those questions in this format. But I think
there was a question about yoga. Is hot yoga in an infrared sauna light, or maybe I'll modify it, is hot yoga and infrared sauna light stretching or any form of hot yoga, is that good?
I think if you enjoy it and you're hitting those sort of intensity targets, so as in you feel like you're working moderately hard when you're doing hot yoga, which I've done it a couple times and I did feel it. So as long as you feel like you're hitting that sort of moderate intensity target, then yes, absolutely beneficial. Just ensuring that you're drinking enough fluids again, and that the heat of the room isn't a sort of a trigger potentially for bronchoconstriction.
Mm-hmm. Thank you. There was a question around, are there any respiratory specialists for athletes wanting to compete at a higher level?
Yep, most, I know in tertiary hospitals, they will offer those sorts of services as well. So, you know, we can certainly look at a lot of investigations. So the, gold standard sort of cardiopulmonary exercise testing in the lab to look at specifically what's happening with the breathing and the different physiological parameters. So most sort of tertiary centres will offer those sorts of services, and also a lot of the more sports specific clinicians as well.
Mm-hmm.
But a lot of high level athletes have asthma, and you know, they're managed really, really well. It's just a lot of, I think there's issues with some of the medications, I believe, I'm not up to date with that, with what's on the sort of anti-doping and things like that, what you're allowed to take and what you're not allowed to take. but most of the asthma medications are okay, and you know, there's a lot of elite athletes who compete at an elite level who have asthma, and it's well managed.
Mm-hmm. And there was another one, it wasn't a question but a suggestion, that Pilates is also good for muscle strengthening, so that's another option.
Absolutely, yes, absolutely.
Lovely.
And things
Well, look,
like
I think
Tai
we
Chi
might.
as well. Sorry, I was going to say things
Yeah,
like
no,
Tai
go
Chi
for
as well.
it.
So there's all
Mm-hmm.
sorts of different activities. Yes, yes.
I do have another question. Do we have time?
Go for it.
Yeah,
Yep.
definitely. Pursed lip breathing, is there more information to learn how to do this, please?
Yes, I can find some and we can send it through. So there should be some videos online I can find. Yes.
Mm-hmm.
Lovely. Any more that you're scrolling through there, Diane? They're a little bit tricky
to find, yes. No, I
yeah,
think we've done pretty good.
fabulous. So I think we might wrap it up here for the time being. And thank you to everyone so much for joining us today. And as I mentioned, we do have a short survey to complete to get your feedback on how we went with today's presentation and find out what else we might be able to present in a webinar format. After the webinar, you'll receive an email with the recording of the class, and that will be in the next couple of days. And remember that to visit our website for more information, or you can book a call with one of our asthma educators, or just call us on our 1-800-278-462 number during business hours for a free call with one of our educators about your asthma. So Janet, thank you so much for your time and expertise, sharing your expertise with us tonight. Diane, thank you. And Dan, our go-to man, thank you very much. And to all our consumers who have joined us today, thank you so much for your interest in our webinars. And we really hope to present something around what you're interested in the future. Thanks, everybody.